Matthew Holt, another THCB Quickbite. I am with the very tall Zak Holdsworth, who is the CEO of Hint Health, which builds an operating system to support direct primary care. Did I get that right, Zak?
Nailed it.
Fantastic. All right, so what does that mean?
Yeah, so we support a few thousand direct primary care doctors across the nation. So we power their billing, their enrollment, eligibility, and really just kind of their back office.
So if I'm one of these direct primary care doctors, I said, hell with it, I don't want to work for a hospital system anymore, I don't want to be poor, or I want to get a different experience. And we've talked to a lot of primary care doctors. You run a conference, which is for those guys, as well as supporting them. When they come to you and say, all right, I want to get down to like a panel of 500-600 or whatever it is, and start charging people, whatever the number is, $2,000 a year, or
$75 a month.
75
would be the average.
Didn't know it was that low. What do they and they say, what the hell do I do? What's the solution you bring to them?
Yeah, totally. Well, so we have, before I start, we've got the software layer. So we recently actually acquired a kind of an EMR as well, so we can give them the full stack of tooling. The other offering we do is we have what we call Hint Accelerator, DPC Accelerator, which is basically a program designed to kind of give them basic templates, the education, and kind of content to how to get started with DPC. And we actually do some coaching there as well. And then we're able to just help support their business through our software. So it helps help them scale and get it started and get off the ground. So.
Excellent. So tell me a bit about the company. You recently made an acquisition. You also raised a bit of money.
Right.
You've been a sort of while getting this going, to be fair.
Yeah.
Tell me a bit about the history.
Yeah, so we got started about 8 years ago, late 2013. Got on the back of this idea. We thought system is broken because the insurance fee-for-service infrastructure, and it's really kind of perverted and broken primary care, and we wanted to be part of a community that was kind of fundamentally transforming primary care. So we started supporting these direct primary care providers. We raised about 15 mil up until about sort of a year ago-ish, so over about 8 years. And we just recently closed a $45 million transaction, and really designed to continue just fulfilling our mission of powering direct care and making it standard.
So how many direct care primary care doctors are there in the US roughly now? How many of those have you got, and how many do you think there will be in 4 or 5 years?
Yeah, I mean, I think there's thousands, not tens of thousands.
Right.
We're kind of the order of magnitude. And we're say majority, we've got more than 50% probably on our platform, working to increase that number. And I think we're seeing, it's not necessarily meteoric kind of exponential crazy growth, but it is consistently growing, 20, 30, 40% a year. And it's consistently, growing through pandemic, through recession, through anything. It just keeps going. And from my perspective, that's actually quite important, right? Like it's not just a flash in the pan. This is a long-term kind of enduring community and movement that's building, and will continue to build, from my perspective, for the foreseeable future.
So in terms of direct primary care, right, we hear a lot about the patient's improved experience, the doctor's improved experience as well, and all the rest of that. And there is a lot of discussion if there's proof that this saves money for down the road in terms of patient care and possibly hospital admissions and all that kind of good stuff that we hear about. It's one of the ways that you're seeing that discussion. How do you think you as a technology company need to sort of help with that part, spreading out to the rest of the healthcare system? Are you kind of done when people leave the primary care office? Or how do you help the direct primary care clinician, support their patients and the rest of the system?
Yeah, I mean, we tend to fast follow our customers and what they're doing. So all of the software we've built has been based on real needs, right? Real things that are happening in the community. One of the patterns that we're seeing is our customers will, more often than not, they'll actually negotiate price transparent cash rates for things like imaging, labs, in some cases specialists. We've seen, pharmacy, top 100 generic pharmacy, cash rates for in-office dispense. And so we're starting by helping our customers, do the way I think of it is we'll just continue to follow our customers downstream and helping instrument the kind of ad hoc processes and relationships they're putting in place with software and kind of technology that helps them scale those things. My favorite example, just to give you an example, is we've got a client that has a relationship with a local imaging center, and when he is with one of his patients, if they have a high deductible plan with say like a $3,000 deductible, he could get imaging for them by referring to the the imaging center, and it'll be like $200 plus a $25 copay, and it's billed through insurance. But he sits down with his patient and says, listen, you're not gonna hit your deductible this year because it's $3,000, and here, look at your expenses. But I've got a cash rate of $75 for the same X-ray, literally the same facility. Would you prefer that? And so that's really quite profound, like in terms of cost savings that you can do when you start paying cash for care. And we want to help scale that.
I mean, does that mean you're heading towards sort of, the folks like Turquoise and others doing transparency? You're heading towards sort of national level cash transparency.
Yeah, I mean, we've been in conversations with groups like Turquoise and others. The vision we have is to help kind of take the ecosystem in that direction. If that's through partnerships, then great. If we have to build some stuff, great. But integrating downstream care is part of our strategic plan. Is, the details of how we're actually planning to do that, we haven't really flushed it out because we're still focusing right now on kind of what I refer to as phase 2 of our 3-phase strategy. Phase 1 is just ensure the success of direct primary care providers. Phase 2 is unlock demand for direct primary care, and that's actually what we're doing through Hint Connect, which is a kind of national curated network of DPCs that innovative health plans or employers or even other DPC networks can plug into. So the vision of that is that it scales DPC. Then the third part of our strategic plan is to integrate downstream care. So we just haven't really gone there yet because we're still working on phase 2.
All right, well, you've got lots to go on with. I'm talking with Zak Holdsworth. He is the CEO of Hint Health. Zak, thanks for your time.
Thank you so much.